Hey folks, Dr. Walker from Walker.com. Welcome back to the channel. And today is Sunday, and if you've not done your grounding work yet, get outside and get the shoes off, the socks off, and get out there and you get some grounding done because, as I said before, grounding is one of those things that will help you sleep. It helps to neutralize free radicals in your system. It's just one of those things that a lot of folks don't recommend or think about because they do not understand the power of grounding. We're one of the few animals on the planet. Just think about it for a second. Few animals on the planet that do not typically have a direct connection to Mother Earth. Think about that for a second. One of the few, and one of the few that have a lot of the disorders and diseases that we tend to have. Anyway, I digressed. Moving on. Today I'm going to talk a little about some vaccines that contain an ingredient called Thimerosal. Now, Thimerosal has been in several vaccines since like the 1930s, and so every couple of years you'll have another group that comes up and says, oh my god, the flu vaccine has this thing, Thimerosal, and it could be associated with all these things. And a lot of folks will come back, well, specifically the three-letter agencies will come back and they'll say no, it's not a problem because the Thimerosal that we're using, mercury that we're using, it's not problematic, right? The problem comes from the other mercury, not this mercury. This mercury is better than the other mercury. So the mercury in Thimerosal is called ethyl mercury. And the other mercury is methyl mercury. So methyl mercury is the problem, but ethyl is not the problem. Now, they do break down into mercury, right? Mercury. And the methyl mercury is associated with lodging in parts of the brain and the kidneys and the lung and the bone marrow, and has been associated with things like autism and dementia and cardiac disease, and actually punches holes in your kidney, methyl, not ethyl, in your kidneys for it to get out of the system. Because the body doesn't have a really good way of eliminating things like metal, like aluminum or mercury in this case. It doesn't have a really good way of sort of disposing itself of those things, except through very aggressive kind of ways. But again, the problem is methyl, not ethyl mercury. Now, again, some associated things with methyl mercury. Now, if you look at all the shots over all the years since 1930, some of them, again, diphtheria, Hep B, flu, have this one ingredient in it, and they tell you it's a stabilizer, so it doesn't grow like fungal material in your shot. Again, that would be a very bad thing. But again, some year they'll tell you that the flu shot specifically is about 30% effective. Some years 40% effective, and other years it's 50% effective. So it's like a coin toss, right? Just to some people, to me at least, it's a coin toss. And again, Walker's not telling you don't get your shots. I'm not telling you that at all. You have a discussion with you and your doc, and determine, you, your doc, and God determine which shots you're going to take. Again, which of these shots containing Thimerosal you're going to take. It's on you. It's on you. Now, the three-lettered agencies will now tell you, again, that in 2025, that they've stopped adding Thimerosal to your flu shot. And again, I do not have a meter that says, can I see the shot first? Let me go and check with my little wand to see if there's actually Thimerosal in there or not. I don't have that little wand. I don't have that. But I have trust issues. And you know that I have trust issues. And so that's where we are. Now, it's the same three-lettered agencies that in 1942 told providers, physicians, do not give people the treatment for a disease that they had, specifically syphilis, the Tuskegee experiment. So from 1942 to like 1972, doctors, and they knew it, what they were doing, was told not to give the treatment for the disease to people. And they didn't. They said, you know what? These agencies recommend that I do not give you this shot, so I'm going to see what the long-term consequences are or problems are associated with syphilis. And they, for 30 years, said, nope, the three-letter agency said not to give it to you. I'm not giving it to you, so there it is, not giving it to you. And it wasn't a doctor that came up and said, you know what, this is unconscionable, that we should not do this. It was I believe, don't quote me on this, I believe it was a reporter who said, this is not right? I'm going to pull the rest, and we got to stop this whole thing. And they didn't. And so the reporter essentially said, I'm going to squeal. And they did. And so that's when it was stopped. Otherwise, and again, 1972 is not that long ago. Some of these same folks who were back in those days are still currently making some of the recommendation guidelines for what happens and what is infused in our system, right? They are still in power to make those things and those decisions happen, right? Again, why I have trust issues. So they had the power then to say, you know what? Don't give it to those individuals. And now they're telling me that the thing that I would have some concerns about, questions, right? I can't get mercury out of my system very well. I'd have some questions about that. But they're the same ones who are telling me now that this thing is ethyl mercury free, thimerosal free. So don't worry about that. It's fine now. It's all good now. So go ahead and roll that sleeve up and take that, and again, it's I say these things because I am as shocked as many people are. So 10 years ago, I trusted the whole system. 10 years ago, I said, yes, okay, let me do what I need to do and kind of move on and whatever else. But I've learned a lot of things since then. And so now I'm very careful about what I infuse into my system. I'm very careful about what ingredients are in things now. And and again, it's up to you and your doctor to determine whether or not one of these thimerosal containing shots are appropriate for you, right? It's up between you and that individual, not between me and you. It's between, so don't say Dr. Walker said, right? It's between you and that individual. But I know for me and my family, I do a lot of reading on a lot of these things, and that's where I am right now. I learned a little while ago that the thimerosal is in these things, and now it's actually out of those shots, and I don't know what I would need to see to believe what I am being told. I just don't know what that would mean. But for me, and for now, thimerosal, whether it be ethyl or methyl mercury, whether it's good or bad, ethyl or mercury, ethyl or methyl, the end result of which is still mercury. And so I'm very conscious now what mercury does to the system. I'm conscious now what aluminum does to the system. I'm conscious about what heavy metals or compounds will do in my body and how they get out, right? So you can imagine a pipe that gets smaller and smaller and smaller and smaller. When you have these things that cannot be broken down by the body, they get lodged in very small, tiny vessels in your brain, in your kidney, in your lung, in your liver, and they do not get out on their own. Thanks for listening, Dr. Walker.